Hi
Okay.
there, Miss
Yeah.
Michelle.
Hi,
How's it
Ben.
going? Your picture's all blocked with that letter.
Yes. Yeah. Well, I'll get rid of it after we've read through that. But
Okay.
today we're just going to look at the myths around supplements and medications for brain health. And Pharmacist Ben is going to just clarify some of the myths surrounding the interactions between nutritional supplements and prescription brain meds.
Yeah,
If you're,
prescription
yeah,
meds in general. We got this
yes,
question from a doc and osteopath in Melbourne, I think, or Victoria somewhere. I don't know
yes,
my Australian geography, unfortunately. He
yes.
says, good guy here. I met him a couple years ago, and he's a pretty sharp fella. He says, I have a number of patients with neurodegenerative conditions, in particular Alzheimer's, Parkinson's, and dementia, and a similar query comes up regarding interactions with medications. We're going to talk about this here in a second. In particular, blood thinning medication, such as Eliquis, but also reflux medications, such as pantoprazole and blood pressure medications, such as verapamil. Not all their doctors or pharmacists are willing to consider using nutrition to treat their patients and tend to be worried about the increased risks of bleeding, calcium levels, and the effects nutrients will have. So first, I got to put the hairs on the back of my neck down so I don't say anything. I don't want to say anything that's going to get me in trouble, because it just boils my blood when I read these things. These people think they're doing their patients a service when they're not. And I'm going to talk about this a little bit more in depth. He goes on to ask, should I be adding anything on top of the HBHP, which I imagine is the Healthy Brain and Heart Pack, i.e. fucoidan, enzymes, probiotics, or will most patients do well with the pack? I would definitely be adding these. We'll talk about that in a second. Any advice you could give me would be greatly appreciated. I know your time is valuable, etc. Okay, so here's the deal. There's a few issues here. First of all, neurodegeneration is the same thing as any other kind of degeneration. And I know I say this all the time, but repetition is reinforcement. This is very, very important. The body breaks down generically. The medical model strategy of isolating and reducing breakdowns to specific tissues and organs is biochemical stupidity or biological stupidity. The body breaks down systemically, and it doesn't matter where it breaks down. In other words, neurodegenerative conditions of the brain are arthritis of the brain. Parkinson's is arthritis of the brain. Arthritis is Parkinson's of the joints. Parkinson's is arthritis of the brain, and arthritis is Parkinson's of the joints. It's the same phenomena, whether it happens in the brain or in the joints or in the heart or in the intestine or in the lungs or in the pancreas. It doesn't matter. It doesn't matter. The only people who care about special organs are specialists, because that's what they live on. But when was the last time a specialist made a difference in somebody's Parkinson's or dementia, with the exception of perhaps reducing the symptoms? We have to get it through our head that the body breaks down generically. This will liberate us from the medical model, which excels, I have to say, when it comes to trauma and when it comes to emergencies and when it comes to stitching us back up when we get hit by a car or rock falls on our head. It excels there. But when it comes to chronic degenerative conditions, which are based in metabolism and lifestyle, biochemical phenomena that are the end result of things we're doing as we live our lives, which of course mostly involves food. And I say mostly, probably 99.9% involves food in the digestive system. And without getting into, being this kind of a preachy mother-like figure that says, eat your vegetables, we have to just understand the logic of it. The body's a closed system. A closed system is defined as a system that is separated from the outside world, like a circle is separate, like a system with a circle around it that's distinct and separated from the outside world. We call that a closed system. In physics, there's a law. A law is something like the law of gravity that's always true, called the law of conservation of momentum in a closed system, meaning in a closed system, everything stays the same. So the body's a closed system, everything stays the same. All the biochemistry works on its own independently. It doesn't change or it doesn't adjust. It doesn't get out of kilter, out of whack, as long as it's a closed system. However, obviously, The body's not a closed system. There's a portal, and that is the mouth and the digestive system. That portal represents the potential for disturbances in the biochemistry or the momentum or the energy of this closed system. And that's why it's so important. And this is why you can backtrack almost every single chronic degenerative disease you can name to some kind of disturbance at the level of the digestive system, specifically the intestine, but also upstream, the pancreas, the stomach, the liver, the gallbladder. And certainly our food choices make a big difference for better or worse. Good foods will support health, bad foods will not. And that's the good food, bad food concept. And it's not as simple as that, because some foods that are supposedly good are not. But in any case, the kind of foods we eat and the way those foods are processed is the number one reason why this otherwise closed system that we call the human body becomes disturbed. So you backtrack to the digestive system. I think it's just too simple. It's too easy. Because other than that, I can't figure out why we're not all over this. So to answer this question, neurodegenerative conditions is deterioration of brain tissue. Degeneration of brain tissue, neurodegenerative. Neuro meaning the brain, degeneration meaning degenerative. The brain degenerates. Why does the brain degenerate? Just decided to degenerate? No, because there's inflammation. Inflammation leads to degeneration. Now, what is inflammation? Inflammation is a defensive response wherever it appears, and all chronic degenerative disease involves inflammation. So all chronic degenerative disease involves a defensive response. What's the offending agent that triggers the defensive response? By definition, if you have a defensive response, you have an offending agent. What's the offending agent? Well, it's not angels sprinkling dust on your head. It's not little elves shooting arrows at you. What do you think? It's things we're eating. It's things we're putting into the body, obviously. Now, the same problems can arise if you inject, because this is also getting things into the body in an even more insidious fashion, because now you're bypassing all the protective mechanisms that are in place in the digestive tract, including the liver. So when you go into the blood, you have a real big problem. And this is why you want to be very careful about injecting things into the blood, if you know what I'm saying. So other than that, for the most part, it's going to involve food, neurodegeneration. Now, the second thing that really gets me ticked off here about this letter, and I don't mean I'm not ticked off at this osteopath. He asked a very legitimate question. He says, regarding interactions with medications, in particular blood thinning medications such as Eliquis, also reflux medication, and blood pressure medication. Not all their doctors or pharmacists are willing to consider using nutrition to treat their patients. Well, then fire your pharmacist. Then fire your physician. He can do whatever he wants. You don't have to listen to him. You don't have to go there. You can go wherever you want to go. But, the problem is we feel intimidated. We don't feel like we're smart enough. We're capable enough. And the medical model is complicit in this intimidation because they make us feel like we're not smart enough. They make us feel like it's too complicated. I want everybody to know this is not too complicated. It's all basically hemodynamics. What does that mean? Well, hemodynamics is the blood version of what's called fluid dynamics. Fluid dynamics is a specialty or school or a segment of physics where they study the movement of fluids. In the body, the movement of fluids is largely the movement of blood, and that's called hemodynamics. And hemodynamics is the movement of refers to the movement of blood when the body's healthy or, unfortunately, not healthy. So I always tell people, all disease is cell disease, but all cell disease is preceded by dirty blood. All of it. Dirty blood means stagnant circulation. The blood delivers oxygen, the blood delivers nutrients, the blood detoxifies, the blood generates electrical charges, and the blood contains a tremendous amount of immune activity, immune cells. The immune system travels, like everything else, through the blood. So if you have a degenerative, inflammatory, immune condition, almost by definition, you're talking about blood toxicity, toxemia, if you will. Emia meaning blood, toxin meaning toxins. This toxemia initiates immune reactions in the blood. Those immune reactions start to spread and get deposited in various parts of the body. These immune factors result in inflammation. It happens in the skin. You get eczema or psoriasis or vitiligo. It happens in the joints. You get arthritis, rheumatoid arthritis. It happens in the brain. You get Parkinson's and Alzheimer's and other health challenges. And I'm telling you, I've been talking about this for years, but now you're starting to see the mainstream medical folks understanding that there's an important link between Parkinson's, which is very similar to dementia. In fact, there is something called Parkinson's dementia, and the digestive system. And they're actually recommending something called fecal transplants for Parkinson's disease. Why? What are fecal transplants? As disgusting as they are, as they sound, they're ways of restoring the microbiome, the bacteria in the large intestine back to health. Meaning, even researchers and medical researchers are now starting to recognize that dysbiosis, disturbed gut bacteria, which leads, of course, to leaky gut and all the sequelae, the symptoms associated with blood toxicity. The mainstream folks are starting to recognize that this is the seat of Parkinson's, meaning also dementia and other neurodegenerative conditions. So as far as these doctors and pharmacists not willing to consider nutrition, okay, they want their best for their patients. That's clear. They're not out to hurt their patients, but this is their thinking. They're in the world of medical the pharmacomedical world. So they're used to using drugs. What are drugs? Drugs are big, powerful chemicals, metaphorically speaking. They're really small, but big, powerful chemicals, metaphorically speaking. They punch, they knock things out, they suppress, they inhibit, and they're very, very powerful molecules. That's why they have to be cleaned out quickly out of the body. They have to be detoxified. And when you take a drug, you're actually taking a higher dose than your body needs to account for the instant detoxification. You put a drug in your mouth, the body gets rid of it. So in order to account for that pharmaceutical agent being excreted or being detoxified and excreted, you got to get a higher dose. So this is accounted for in your dosing. The body gets rid of these toxins quickly. That's not how nutrients work, but because physicians and the medical folks are conditioned to believe that medical intervention involves big brutes, molecular brutes, like poisons and toxins, they think that nutrients are the same thing. So they say, oh, don't have vitamin K when you have a blood thinner because vitamin K is associated with blood clotting. It's not like you take vitamin K and all of a sudden your blood clots. Vitamin K assists in clotting chemistry. Now, you take a blood clotting drug, or I should say a blood thinning drug like Eliquis, which is this person's talking about. That doesn't work kindly and gently. That doesn't assist. That literally thins the blood. You see the distinction here? Nutrients help. They assist. They don't cause. So when we say vitamin K is associated with blood clotting, we mean it supports blood clotting. When we say vitamin E is associated with blood thinning, we mean it supports blood thinning, or essential fatty acids. In this case, he's asking about EFAs. They support blood thinning. They're not going to make your blood thin like Eliquis will, but because the physicians and the medical folks are trained in this pharmacomedical model, they think that their worldview is that these interventions that we call the Mighty 90 essential nutrients are going to have the same kind of effects as drugs, and they're going to counteract them or neutralize them or amplify them. That's not how they work. In fact, the more drugs you're on, the more you need the nutrients. Your drugs will work more effectively, and you'll be able to reduce the dose on your drug if you take nutrients. So if you take EFAs with your Eliquis, you'll be able to reduce your dose in your Eliquis, which is a good thing because Eliquis is a major toxin, and EFAs, instead of contributing toxicity and side effects and adverse reactions, they support joint health, and they support heart health, and they support genetics, and they support skin health. So you get all these wonderful benefits with your EFAs. Instead of having a powerful toxic brute like Eliquis, you've got this gentle support system that helps the body thin, or helps the blood thin, and you get wonderful benefits aside from that. How cool is that? It's like a no-brainer, right? To me, it doesn't make any sense to be worried about your poison, to worry that the nutrients are going to interfere with your poison. Use your nutrients so you can take less poison. I said, what else does this gentleman say? Not all their doctors are willing to consider using nutrition to treat their patients and tend to be worried about the increased risk of bleeding. Calcium, this is what they're saying. They think the EFAs and the Mighty 90 essential nutrients are somehow going to enhance or increase the effects of the drugs. No, or perhaps counteract. No, That's not how nutrients work. What's more, because nutrients are associated with all kinds of health benefits, all kinds of important biochemical reactions, you're going to be supporting those. And if you eliminate those nutrients, you're going to be depriving the body of those. So you say, oh, we don't want you to take those EFAs with your blood thinner because it might thin your blood more. Now you're at higher risk for heart disease. You're at higher risk for skin disease. You're at higher risk for brain health issues. You're at higher risk for autoimmune problems, all the things that EFAs support your health for. So it's just crazy to me. Absolute craziness. Do you have any suggestions on how to get around this? I don't, except to say, find another doctor, find a pharmacist, find a biochemistry-minded healthcare professional. See, there's two kinds of chemistry. There's clinical chemistry, and there's lots of different kinds of chemistry. But in the health world, there's clinical chemistry, and there's biochemistry. Biochemistry is the study of how chemistry works, what we call the pathways, how A gets turned to B, to C, to D in the body. These are biochemical pathways, and they're very complicated, and they're very networked. So you interfere with them at your peril, because when you interfere with one, you have this the spider web effect, where you touch one spider web because everything's affected. You touch one line on the spider web because everything's affected. You affect the whole web. So when it comes to nutrients, or when it comes to drugs, I forgot what I was talking about here. When it comes to increased risk of bleeding and calcium levels and the other effects nutrients will have, use the nutrients, reduce your dose on the drugs. I think I lost my train of thought here, but continuing on, do you have any suggestions on how to get around this? How to get around this, and how big is the risk with taking minerals? There's no risk with taking minerals. Minerals are detoxifying, minerals are nutrifying, and minerals support biochemistry. No risk taking minerals, zero. Do you have any suggestions how to get around this? Yes, fire your doctor, fire your pharmacist, find a doctor. Oh, I remember I was saying clinical chemistry and biochemistry. So the distinction between biochemistry and clinical chemistry. Clinical chemistry, biochemistry is the chemistry of pathways. Clinical chemistry is the chemistry of numbers. It's the chemistry of statistics. It's the chemistry of test scores. Clinical chemistry gets done by clinicians. Clinical chemistry gets done in the clinic, in the doctor's office. So they'll take your blood pressure, your fasting blood sugar, or your TSH, your thyroid stimulating hormone, or whatever it is. They'll take measurements, and then they'll stick them into a computer and see what they come out, and they'll determine whether you're high or you're low. Well, this is not the way human beings should be assessed, because every human being is different. Comparing your numbers to a reference range to determine if you're high or low deprives you of your individuality. As a human being, you have a biochemical individuality. Your biochemistry is unique. You can't be compared. What's high for the standard may be perfect for you, or what's low for the standard may be perfect for you. So what you want to do is you want to go by your symptoms. Always go by your symptoms. And that's how you assess how healthy or unhealthy, or how well your nutrition or medication is working. You look at the symptoms. What we like to do, because, for some reason or another, we live in a society, we live in a world where we're so focused on numbers, and we're so focused on statistics, we look at the numbers and statistics rather than our own observations. A good clinician, a good healthcare professional is going to look at the patient and talk to the patient. And that's really the best way to assess how well a medication was working, or whether medication is needed, or how well nutrients are working, or what's going on with the patient. Sometimes you need testing to support your observations, but your observations are key. That's what you want to be going by, is your observations and the patient's symptomology. So how do you get around this? You just find another healthcare professional. That's how I would get around it. Or even better, study your body. Learn about the body. Learn how the body's put together. It's not that complicated. As I say, it's really all about the blood. It's really all about toxicity that enters into the blood. It's really about immunity in the blood and in response to toxicity in the blood, which always starts off at the digestive system. And the blood sugar system is also involved, because that has something to do with food. Really, what we're talking about here is energy. Food is how taking food into the digestive system is how the body gets raw materials for energy, and then that food gets broken down by the metabolic system, and that's how the body actually derives energy from the components. And those are that's why they're the 2 points on the triangle disease, the base of the triangle, because this is how the body gets energy. Body is running smoothly. All the energy in the body is running smoothly, and then you input a bunch of energy. You got to be very careful. Luckily, there's a bunch of biochemistry that kicks in to stabilize all that energy. Think of a glass of water, and you shake the glass of water, and it kind of it kind of, or a bowl of water, we'll say, and it kind of moves, all the water moves, and then it sort of stabilizes. That's what happens when you eat. You eat and all the water moves, it shakes around, and then it stabilizes based on biochemistry. Hormones like insulin, for example, are involved in stabilizing all that energy. As the input of energy becomes chronic and excessive, the body loses its ability to calm the water down, and it's constantly moving. Can you picture that? Picture a tub of water, and it's constantly moving. It never settles down. And this is where the disturbances come from. This is where the overall health challenges come from. So that's why fasting is so important. Fasting calms everything down. Let's see what else he says here. Taking minerals. Minerals are awesome. There's no contraindication with minerals, with colloidal minerals, plant-derived minerals, and the drugs. He wants to make sure it's safe to do it. Absolutely safe to do this. Then he asks about, is there anything else on top of the Healthy Brain and Heart Pack? Yes. Fucoidan is amazing for the blood. Fucoidan is a lot of things, but one of fucoidan's best benefits is it helps liquefy the blood. It helps improve blood flow, perfusion, if you will, in a way like the ultimate EFAs. Enzymes also improve blood perfusion, but not in a way that's going to amplify or cause the blood to thin too much. It's not going to cause excessive blood thinning. In fact, what you really want to do is you want to start taking all these, as I say, and reduce your dose in your Eliquis. Probiotics and enzymes also help the digestive system. Likewise, probiotics. As I said, Parkinson's disease, neurodegenerative conditions are linked to gut issues, leaky gut, SIBO, histamine, all of the things that we talk about as being the first point of the triangle of disease. Using probiotics and also digestive enzymes will help. Taking digestive enzymes on an empty stomach will improve blood flow and perfusion. Likewise with the fucoidan. Fucoidan is also a wonderful anti-inflammatory. And by the way, digestive enzymes are also anti-inflammatory. There's no contraindications with any of this. If your physician and your doctor says, I don't want to do that, find another physician doctor. Now, you may have an issue in, down under your medical care is paid for. So it's a little bit trickier. I don't know if you can fire a doctor. I don't know how that works. But here in the United States, if any doctor ever tells you, we don't want to give you any nutrients, we want you to stop taking your nutrients, so you take your drugs, and you want to take your nutrients, find another doctor. Don't be intimidated. Read up on these things. It's not that complicated. Don't be fooled into thinking it's complicated. It really is not. It's as simple as garbage in, garbage out. Or if you want to be a little gentler, we'll say the bad stuff, the good stuff in and the bad stuff out. Good stuff in, bad stuff out. And that's really what we're talking about here. As far as nutrients go, I would also throw in the Synaptive, which has nutrients that are really important for brain health. Probably, I don't see any vitamin E here, but I would add some vitamin E. Vitamin E is really important for the brain, although it will thin the blood. I don't see anything about iodine. Iodine may also help with mental health issues or brain health issues, we'll say. And then selenium, ultimate selenium might help. That's also important for brain health. And also just keep in mind the triangle. So this is a gentleman or person, I think it's a gentleman, who also probably has who has blood sugar issues, metabolic syndrome. Metabolic syndrome and dementia go hand in hand. In fact, dementia is actually called type 3 diabetes. The diabetic reaction, the biochemistry of diabetes that involves something called glycation, which is burning of proteins, also affects the brain. So advanced glycosylated end products are also linked with poor brain health and issues like dementia. As I say, Alzheimer's is called type 3 diabetes. And of course, the third point in the triangle is also going to be involved, and that's the adrenal cortisol thyroid axis. So this patient is probably likely hypothyroid and has cortisol issues as well. That's tertiary already, because you can't really work on the thyroid by itself, but just simply working on the digestive system and the blood sugar system and using all the aforementioned nutritional supplements, you can make a huge difference in all neurodegenerative conditions, whether it's Parkinson's or whether it's Alzheimer's, dementia. And it's funny because there's all these different types of dementia. They're all neurodegenerative. And it doesn't matter whether there's Lewy bodies there or whether it's early onset or it's late onset or whether it's Parkinson's dementia. You're talking about deterioration of tissue, degeneration of tissue. Whenever you have deterioration and degeneration, you have inflammation. Whenever you have inflammation, you have immunity. Whenever you have immunity, it means you've got something has gotten into the body, which almost always refers to food and digestion.
We've got a couple of people on the call. Ansley, she's saying your guts, your digestion. If it's bad, you're off. People don't drink enough water either.
Water is a big part. Absolutely. Water is very, very important. You got to be careful with water, though, because if you're drinking tap water, you don't want to know what you're drinking if you're drinking tap water. Do you know there's 80,000 different chemicals that were subject to exposure? It's called the exposome, by the way. The exposome is the 80,000 different chemicals in the environment that we're exposed to. Many of them are in the water, and we're drinking them. So you got to be careful about drinking water. I like, ideally spring water is the best water if you can find clean springs. And, we don't know you can't assume that all springs are clean, but ideally spring water is going to be the best. It's water that's been vorticized and structured. Other than that, reverse osmosis and then probably distilled are the best forms of water. So yes, drinking water, and even better than drinking water is vegetable juice, because then you get a lot of nutrients there too. And also BTT water. I know you can't see this very well, but BTT water. Put a little BTT, because the more water you drink, the more electrolytes and water-soluble vitamins you excrete. So ironically, if you're drinking a lot of water and you're not replacing your nutrients, like with BTT, you can actually become deficient in water-soluble nutrients and electrolytes by drinking water. In fact, there's a condition called hyponatremia, which is deficiencies in the concentration of sodium that people get when they drink too much water. You can actually die from drinking too much water because you dilute your electrolytes. You have to drink a lot of water to do that, obviously, but the point being that when you drink more water, you got to replace your water-soluble nutrients, your B complex and your vitamin C and your electrolytes, because you're losing them in the urine. But drinking water is definitely important, especially first thing in the morning. It dilutes the blood. You get more blood flow to the brain. You get more energy. You get better cognition. Water is amazing stuff. Very, very important. The body is, we should talk. In fact, let's talk about water on our next little video that we do. I'll tell you this. I'll give you a little hint, a little taster. The body is made up of 60 to 70% water. You've heard this, right? But how exactly can that be? How can we be made up of 60 or 70% water and not essentially be a puddle sloshing around the sidewalk as we walk or up and down the stairs, right? That doesn't really quite make sense, that you could be 60 or 70% water and not be this puddle, right? And if you squeeze your finger, water's not going to come out. What is going on with the 60 to 70% water? We'll talk about that on our next video. So yes, water is very important. Did this person have another question?
No.
Let me say one more thing. There is something called the gut-brain axis, too.
Yes.
So we're talking about the triangle of disease, where the foods you eat go into the bloodstream, and then you get blood sugar disturbances, and then you have issues at the third point. That's a triangle of disease. But independent of that, there's the direct link between the gut and the brain. They call it the gut-brain axis. And secretions from bacteria that get into the blood will go right into your brain, for better or worse. For example, gluten. You can actually have grain brain. There's a book called Grain Brain that talks all about this, where you can have gluten intolerance of the brain, and that can cause neurodegenerative issues. That's directly from the digestive system to the brain. On the other hand, bacteria make a wonderful, wonderful short-chain fatty acid, we'll just say a fatty acid, that is very important for brain health, called butyrate. It's also important for colonic health and intestinal health, and they're produced from bacteria they go right into the bloodstream, they go to the brain, and they make you feel satisfied, they make you feel happy, and they're antidepressants, and they help relax you. And this is directly from the gut bacteria to the brain. You can assume that histamine and other toxins are doing the same thing, also causing mental health or brain health, organic brain health problems. That's the direct link from the brain from the gut to the brain, called the gut-brain axis.
So Ashley is saying, I had cysteine stones, now just sand. Alkaline water, 8.4 pH, turned my urine to alkaline, and cysteine stones cannot grow.
Dissolved? The cysteine stones dissolved?
She's saying, I killed off fibromyalgia, bursitis, IBS, severe brain fog, obesity.
With what, alkaline water?
Sounds like it. Yeah.
I don't know how that would work, but it's true that alkalinity maybe there were minerals in the alkaline water. It might have done that. There might have been the minerals that did. I don't know how that worked. The way we're supposed to alkaline is? What's the most alkaline substance that we interact with on a regular basis? Do you know? This is how God wants us to alkaline. That's how nature wants us to alkaline. Oxygen. Oxygen.
Oh, okay.
Oxygen. That's how you're supposed to alkaline. That's one of the reasons why oxygenation is so relaxing. Like respiration, I should say, is so relaxing. is because that's how we stay alkaline. There's probably some electrolytes like certain blood electrolytes that have an alkalizing effect, but for the most part, it's oxygen that alkalinizes. And fibromyalgia, bursitis, IBS, and brain fog are all related to the first 2 points in the triangle of disease. Do you know 80%, or not 80%, 90%, maybe 95% of fibromyalgia patients are women? Do you know 80 to 90% of autoimmune disease patients are women? What is going on there? Why? What is going on? Why most patients who have chronic degenerative diseases, autoimmune diseases, hypothyroidism, depression, fibromyalgia are women? Why is it so hard to be a woman? Why? Whenever you have a gender difference and a health challenge, the first thing you want to look at is estrogen, which is the quintessential female hormone. And estrogen being very pro-inflammatory, and even worse, breakdown products of estrogen that are called catechoestrogens that build up when you're not detoxifying properly. They're super, super toxic and aggressive. Estrogen has to be cleared out of the body quickly. It's the most powerful of all the steroid hormones. So fibromyalgia goes hand in hand with IBS. Why? Because estrogen is metabolized in the intestine. Bursitis is inflammation of the muscle. That could easily be related to toxicity that's getting into the bloodstream. Likewise, brain fog. Obesity is associated with metabolic syndrome. Again, the second point on the triangle of disease. These are classic symptoms of the triangle of disease, of the breakdown at the level of the digestive system, the blood sugar system, and the adrenal thyroid complex. She says alkaline water turned my urine alkaline and cysteine stones. Well, I wouldn't jump to those conclusions, but if it works, it works. What does Nebraska mean?
I said, where are you from? She's from Nebraska.
Oh, she's from Nebraska. Okay, great.
Yeah.
I drink mineral
water. And we've got another lady on board from Vancouver as well.
What's that?
We have another lady on the call from Vancouver.
All right. I hope you guys are enjoying our short little videos, which aren't so short sometimes.
Yeah. So I've also got the question from Daniel, who suffers with bipolar. He tried to wean himself off his bipolar meds. You know the name because we discussed it before the call.
I'm going to make you say
it. I'm totally.
I'm just kidding. Aripiprazole.
That's right.
Aripiprazole.
Right. So what happened? He ended up having a psychotic situation and got admitted to hospital when he tried to wean himself off. He would
aripiprazole. Yes.
He'd dearly love to be off it because he said
aripiprazole is a drug, is an antipsychotic drug. These are for different brain health issues. It involves the hormone dopamine. Dopamine is a neurotransmitter that's associated with action, doing things. You can't open the door, open a can of mayonnaise, a jar of mayonnaise, or lift a pencil without dopamine. Dopamine helps us do things. That's in the small run. In the big run, it helps us go over the next mountain to see what awaits us over the next hill, kind of thing. You know what I'm saying? It gives us, it allows us to it pushes us forward. They call it the molecule of more. It pushes us forward. Without dopamine, you can't go forward. So the thinking is, by calming down the dopamine system, you calm down hyperactivity, and a lot of the antipsychotics block dopamine, work with dopamine. Aripiprazole is a little bit different. It kind of balances out dopamine. Nonetheless, it works with the dopaminergic system. Now, I'm always a little bit hesitant to talk about nutrition for mental health issues because many of us are suffering from what's called adverse childhood experiences, ACEs. In fact, here in the United States, there's something called the ACE study. And the ACE study shows that almost everybody who's got a long-term chronic degenerative disease, something like 78% of people who have long-term chronic degenerative diseases, suffer from adverse childhood experience, suffer from the effects of adverse childhood experiences. And this is also true about mental health issues. Bipolarism, up and down, manic, they used to call it manic depressive disorder. Bipolar disorder, in a very interesting way, is a coping mechanism. It's a way that we don't confront traumas or things that are bothering us, things that are fundamentally worse than bothering us, that are traumatic. You know, if you have a traumatic issue, by being depressed and being excited, manic and then depressed, and then manic and then depressed, manic and then depressed, it's almost like it's a diversion technique So you don't have to look at issues. So I'm always hesitant to use organic strategies for what are really spiritual, mental, and emotional. That being said, there's wonderful nutrients for the brain, and there's wonderful nutrients that can protect the brain from toxicity in the blood. So first of all, you got back to your triangle, work on digestive health, probiotics, daily digest, I-26. If this patient has digestive symptoms, that's great. Why? Because now you have a metric, symptoms that you can use as a metric, a barometer to see how successful your treatments are. If you don't have digestive symptoms, and chances are they do, but if they don't, then you use your mental health as a barometer metric to see how well your digestive health strategies are working for your brain. Laying off gluten, laying off lectins, all the problem foods that we talk about, the bad foods, as well as foods that may increase histamine, etc. Work on digestive health is what I'm trying to say. Then you stabilize the blood sugar system. I have a book in my reference library called Insulin and Psychiatry. They used to use insulin. They used to use insulin for mental health issues. Why would they use insulin for mental health issues? Well, insulin stabilizes blood sugar. So by giving patients insulin, their blood sugar dropped and they had better mental health, psychiatric health. So working on the blood sugar system is very important. If you're insulin resistant, then sensitizing your body insulin, using the healthy brain and healthy blood sugar pack, and then also keeping your calories down, change what you eat, all the diabetes things, all the blood sugar things, the dysglycemic strategies that we talk about. And then thirdly, cortisol plays a major role in brain health issues or mental health issues. Stress, obviously, is going to make you anxious, cause worrying. It's going to affect your brain, calming the body down. Oxygen, as we said earlier, will calm the body down, but there are also nutrients that you could use that will calm the body down. For example, we talked earlier about essential fatty acids. Essential omega-3 essential fatty acids have a calming effect, and they're especially important for the brain and the nervous system. So omega-3 fats from flax seeds, from your ultimate EFAs, from chia seeds, hemp seeds, or you get fish, DHA and EPA. They don't have EFAs necessarily in them, but they have omega-3 fats called DHA and EPA, which are very important for the brain. And those can also help for folks who are dealing with bipolar issues or mental health issues of any kind, really. Let's see, also for the eyes, omega-3s are very important. Zinc is very important for the brain. Vitamin A is very important for the brain. There's a whole host of nutritional supplements that play an important role in neurology, especially the fats. If you were asking Dr. Wallach, you know what he would say? Eggs.
Oh.
Eggs. Eggs. But don't cook your egg. Don't burn your eggs, or don't cook your eggs with too much heat, because you'll break up that cholesterol, and that cholesterol is really important for the brain. So also making sure you're eating correctly, that helps. Organ meats can be helpful. There's a group of nutrients I call the cholesterol complex that's found in organ meats, found in dairy, found in a lot of the foods that we're not supposed to be eating, actually, but mostly dairy and eggs and organ meats. Contain this what I call the cholesterol complex, which is a bunch of molecules that include lecithin and phospholipids and vitamin K and cholesterol and vitamin A and vitamin D also, that are very important for building things. And these building substances can help counteract some of the effects of neurodegeneration. And if you work on the offending agents that are causing the neurodegeneration, and at the same time taking these anabolic building nutrients like vitamin K and vitamin A and phospholipids and cholesterol, you'll kind of hit it at both angles. You'll reduce the inflammation, the degeneration, and you'll build the body at the same, or the brain, or the neurology, or the body at the same time.
Great. Yep. Thanks for that. That was pretty comprehensive. Thank you.
Right.
Has anyone else got any questions?
Do we actually have people watching here?
Yes, we do. Yeah.
Oh,
yep.
Hi, everybody.
Yep. Yeah. Nobody's got any more questions?
I can't see anybody.
No, you don't see them on this.
No.
You just see their interactions. So just hang on, I'll put the overlay back up.
All right. Well, nice to not see everybody, I guess.
Yeah. It's not like Zoom.
Not like Zoom. All right.
Yeah. All right.
If you like this stuff, let us know. We are going to be on. Try to do it every day. I think we skipped a day here and there, and I do travel, but we'll try and do them every day. And then we're going to talk tomorrow. We'll talk about water.
Water. Okay.
Water.
All righty. Fantastic. Okay.
All right, Michelle. Have a good evening or good day.